So this is my audience. Okay, 3. Okay. Okay, so today, thank you guys for coming. Today I'm going to be talking about fetal alcohol syndrome and the effects that it causes children. According to CDC.com, last access on July 4th, 2019, 1 in 20 U.S. children actually have fetal alcohol syndrome. Fetal alcohol syndrome is the only developmental disorder that is 100% preventable. The number one cause of mental retardation. I'm going to speak today about what fetal alcohol syndrome is, the effect, how it affects children, and the cost and treatment of fetal alcohol syndrome. What is fetal alcohol syndrome? Fetal alcohol syndrome is a group of birth defects that happen when pregnant women drink. Never is alcohol ever okay for pregnant females. When pregnant females drink alcohol, it travels through the placenta to the fetus. At this stage, the fetus is primed for developmental and brain development. Children that are affected by this are abnormally small at birth. Some children, some or even all children have organs that may not properly develop correctly, depending on how severe the mother drinks. There is no cure for fetal alcohol syndrome, but the effects of fetal alcohol syndrome last a lifetime. Diagnosing the child is met by 3 criteria: facial abnormalities, growth and brain development, and central nervous system damage. So there are physical abnormalities that are obvious to our eye. According to the physical aspect of the abnormalities are the facial that are very distinctive. Some of these are extra skin by the eyes called epinal folds. The others are flatter on the forehead, and the thinner lip, the upper lip is thinner. Other organ development causing hospitalization that cause problems to the heart and kidney not developing correctly. Vision and hearing are also problems. So some of the not so obvious developments that we see in a child that has fetal alcohol syndrome is the brain. The brain is one of the biggest is one of the ones that are not so obvious to our eye. So this is a brain at 6 months old, a normal brain, and this is a brain at 6 weeks old with fetal alcohol syndrome. There's a big difference. Many children have problems paying attention, and even speech problems. The brain so that's the brain. Okay, so some statistics are 90%. So people who have alcohol syndrome, some of the statistics are 90% more likely to experience mental health issues, 60% more likely to get in trouble with the law, and 30% more likely to have drug and alcohol problems. So now there is no cure for FAS, but there's long-time treatments that is very expensive. There is always treatments and medicine to help symptoms of fetal alcohol syndrome cause, but the only cure that will ever be is that pregnant women stop drinking. Therapy can help with behavior problems and educational problems. Medicine and hospitals will always have help for treatment for them for the bigger problems. According to CDC, at last access on July 3rd, 2019, the lifetime cost for one individual child with fetal alcohol syndrome is $2 million. People with more severe problems, it's estimated to be $4 million annually. Fetal alcohol syndrome is simple. The only way is to stop drinking. According to the CDC last access on July 4th, 1 in 9 pregnant women reported still drinking today. And then alcohol syndrome is 100% preventable. And that's it. Thank you for watching.